Very good morning to you all and welcome to Dental Amaze Academy. Now, as you all know, today we're going to start with anatomy and we're going to do phase 1 of anatomy. So please note, anatomy is going to be done in two phases, phase 1 and phase 2. And why that is, I'll tell you. Okay, so today we're going to start with phase 1 and I'm going to explain to you how the phase 1 is going to get covered, and then I'll go to the phase 2 part. Okay, what are the topics covered in phase 2? In phase 1, we're going to start with the first part, which is the side of the neck. Okay, you might have heard of something known as deep cervical fascia, investing layer of deep cervical fascia, like that. So it's a very, very important topic, and that is where we're going to cover side of the neck, except the posterior triangle. Okay, we're going to do posterior triangle little later. Okay, there is a reason for that. And along with the side of neck, we're also going to cover the muscles in the region of the neck. After that, you're going to get a test paper on this particular portion. Then we'll go to the anterior triangle. And in anterior triangle, we're going to give a small review on nerve supply of the neck. It's very important to understand, though face is much more important, and that we're going to cover later on, nerve supply of head and neck separately, but a little bit of review of the neck, because you have to understand certain structures and supplies in that region to understand the anterior triangle. Okay, so the major nerves discussed will be glossopharyngeal, vagus, accessory, and hypoglossal. Okay, now it will be continued for the next day because it's a little long topic. It will be continued, and yes, then we'll go to spinal nerves. Okay, most of you might have heard of cranial nerves. So spinal nerves, its distribution, how it originates, and all is important, and which is very much related to what is known as cervical plexus and brachial plexus. Okay, very confusing area, but it is simplified for you. And then after that, we're going to go to sympathetic ganglia, again a related topic. Okay, there is parasympathetic ganglia and there is sympathetic ganglia. So first, which is related to the spinal nerves, you're going to do the sympathetic ganglia and the trunk. Okay, now some might not be able to connect it, but yes, you'll understand it once you watch the lecture. Then we will go to the posterior triangle, where we will be again continuing with the same topics which is related to it, the cervical plexus, brachial plexus and all, which is in relation to the posterior triangle. So that will be that. Then after that, you will again get another test paper for these portions covered. Then we will go to the most important topic for you all, nerve supply of head and neck. Very, very important, including the parasympathetic ganglia and the related nuclei. Okay, yes, it's very, very important. So it will be continued the next day as well. Then you will get a topic-wise test paper on these portions. After that, we'll be going to the blood supply. Now, nerve supply and blood supply, very, very, very important. Okay, blood supply of head and neck, and we'll understand certain specific blood supply is very important for you all. Now after that, again a test paper on blood supply. Finally, after that, at the end of all these, we'll have a test paper covering all the portions. By that, we will conclude phase 1. Then we'll go to the next subject, and so that you are not feeling bored with anatomy. That is very, very important. When you continue for a very long period and when you're learning it at a good speed, what happens is that there is a high possibility that you can get confused. Now, there's a second reason also why we are doing phase 1 and then there's a small space where we are covering other subjects and then coming to phase 2, because for you to understand phase 2 well and good, you have to be very thorough with phase 1. So we'll be continuously revising anatomy phase 1 topics. Okay, then we will go to the phase 2. Okay, so the schedule will be provided later. Okay, now, but just understand what you're going to cover there. Parotid gland, submandibular gland. So all these nerve supplies you studied, blood supplies you studied, you can connect it with the thyroid region, all those. Temporal, infratemporal, one of the very, very, very important areas. There are lots of fossas out there, and most importantly, TMJ and muscles of mastication. Yes, you know the importance of it. Now after that, we'll be covering a little less important area, which is prevertebral, paravertebral region, small areas to be covered, crucial areas, contents of vertebral canal. Definitely it's again related to your spinal nerve, okay, and spinal cord, cranial cavity, meninges, cerebrospinal fluid, all those, and its connection to the nerves. Okay, then we will go to the contents of the orbit. Okay, and yes, along with that, we'll also discuss mouth and pharynx. You all know that this is a very, very confusing area, but it is simplified at the best level for you all. And yes, the most crucial areas are well and good explained for you all. Okay, and it's very important, the nerve supply pharynx, the muscles of pharynx, the muscles of larynx. Okay, very, very important. Okay, then the tongue, you all know nerve supply of tongue, the blood supply of tongue is important, the regions of the tongue, how they develop, everything is very, very, very important. And yes, the muscles of the tongue. Okay, then you have to understand the paranasal sinuses and pterygopalatine fossa. So small spelling mistake up there, palatine. Then we'll go to osteology. Now it's a topic in its own. Okay, we'll go to osteology. Lots of things are there. Now it's not like what you've studied for your theory exam. A slight difference. We are not going into that methodology. There's a different methodology. We'll go for that. Then we'll go to one of the most confusing area for any dentist: brain, spinal cord. Okay, again, we have studied lots of nerves. So now we are going to connect it with the regions of the brain and as well as to the spinal cord and the structure of spinal cord. And very, very importantly, ascending and descending tracks. Now, many students will connect this with physiology then anatomy, but yes, the best way you can do is once you finish your physiology. By this time we are doing phase 2, we have already done with physiology and lots of other subjects to connect it all together. So here we are going to study different pathways, okay, taste pathway, pain pathway, your vision pathway, hearing pathways, all those ascending tracks, descending tracks, so like that. So this is how it will be covered for you all. Anatomy notes will be provided. Okay, first the notes will be provided for phase 1 and at a later stage phase 2 notes will be provided. Okay, two topics I missed out there is histology and embryology. Now, histology is a very small area, needs to be covered in perspective of NEET MDS preparation or INI-CET MDS preparation. It's not so big, but yes, there are some very crucial areas like what type of epithelium is seen where is a very important question. A little bit of bone histology, a little bit of cartilage histology will do. Now, embryology is a much more important topic. You all know the development of embryo, what are the stages out there, what are the structures out there. All these are very important, and development of face is very important. Cleft lip and palate related embryology is important. Then, as you all know, different pharyngeal arches and structures originating from them. So this is very important area, embryology, and we'll go in detail into that. Okay, so notes will also be provided for phase 2, and that is how phase 2 will be covered, as well as test papers. This is just an overview, and please note, overall I've just given you an overview of how the topics is covered. The lectures are even more detailed. I've just told you what are the key areas which we'll be covering in phase 1 and phase 2. So thank you so much. See you in the classes. Bye.